Imagine this. It's 3 in the morning and the world outside is silent. Your bedroom is cool, dark, and perfectly still. You are finally in that deep, heavy, restorative sleep, the kind we all crave as we get older, where the body heals and the heart truly rests. Imagine this. It's 3 in the morning and the world outside is silent. Your bedroom is cool, dark, and perfectly still. You are finally in that deep, heavy, restorative sleep, the kind we all crave as we get older, where the body heals and the heart truly rests. Our brain won't let it go. With a heavy sigh, you throw back the blankets and your feet hit the cold floor. You shuffle toward the bathroom like a zombie, squinting against the harsh glare of the light. You do what you came to do and stumble back to bed, but the magic is gone. Now your mind is racing about your health, your family, or the chores for tomorrow. You lie there for an hour staring at the ceiling, and just as you finally drift off, it happens again. If this is your life, you are not alone. Millions of seniors wake up every single night to use the bathroom. Some once, some 3 times, and some 5 times. Here is the cold, hard truth that nobody is telling you at your standard doctor's appointment. In 80% of these cases, your bladder is perfectly healthy. Stop buying the expensive prostate supplements. Stop the herbal teas. Stop the bladder-strengthening pills. You are aiming at the wrong organ entirely. My name is Dr. Ben, and after 15 years of clinical practice, I am here to shatter the dangerous illusion that waking up at night is just a normal part of growing old. It isn't. At 60, 70, or 80, a healthy body should be able to sleep through the night. If you don't fix the root cause, you aren't just losing sleep. You are aging your brain and straining your heart at an accelerated rate. When you wake up to urinate, your body undergoes a violent physiological shift. Your pulse jumps and your blood pressure spikes. For a senior, this interruption is even more taxing. Most importantly, you interrupt the phase of deep sleep where your brain clears out metabolic waste. Clinical research shows that this condition, called nocturia, stresses the cardiovascular system faster than smoking. That is not an exaggeration. That is data. Many patients come to me and say, "Dr. Ben, it's just my age or it's my prostate." They restrict their water intake so aggressively that their mouth goes dry by evening, and they still get up at 3 in the morning. Why? Because they are fighting the symptom, not the cause. Think of your bladder as a fire alarm. Most people are trying to cover the sensor with tape to stop the noise, but the correct response is to find where the fire is. In the vast majority of cases, the problem is not the reservoir. The problem is who is filling it during the night and why. The real culprits are your legs and your heart. For 16 hours a day, you are vertical, sitting in your favorite chair or walking around. Gravity pulls fluid down into your lower extremities. As we age, our veins lose their elasticity and the valves that pump blood back up become sluggish. Fluid gets trapped in your leg tissues. You can store up to 1.5 liters of fluid in your legs without them even looking swollen. The moment you lie down to sleep, gravity loses its grip. That fluid rushes back into your bloodstream and your heart detects a massive overload of volume. It panics and releases a powerful hormone that sends a telegram to your kidneys to dump the excess fluid immediately, or the heart will fail. Your kidneys go into emergency mode and filter at an accelerated rate. Your bladder fills up and you wake up. You aren't drinking through your mouth, you are drinking through your legs. Before we fix this, you must know 3 warning signs that require a doctor immediately. If you see blood in your urine without pain, that is a serious sign. If you have bone pain combined with sudden weight loss, or if you feel a desperate urge but nothing comes out, go to the emergency room. If none of those apply, you are going to be fine, but we need to protect the quality of your life. To stop the midnight alarms, you have to wring out your body before you hit the pillow using my golden protocol. It starts in the morning. When you get out of bed, do not head straight for the coffee. Stand upright and rise up onto your toes just an inch, Then let your heels drop back to the floor with a firm impact. Repeat this 30 times. This rhythmic vibration shakes your venous valves back into action, encouraging blood to move upward against gravity so it doesn't pool in your ankles by evening. If standing is hard for you, lie on your back and shake your legs in the air like a beetle for 1 minute. Next is the daytime rule. Shift your hydration schedule so that 70% of your total fluid intake happens before 4 in the afternoon. After 4, you turn the tap down. Not off, because dehydration is dangerous for seniors, but only take small sips. Most importantly, remove the salt shaker from your table. Hidden salt in cheese, processed meats, and bread acts like a sponge, locking fluid in your system until you lie down. You aren't urinating water at night, you are urinating last night's sodium. The most critical move happens 1 hour before bed. While you are watching the news or reading, do the exercise I call the lazy elevation. Lie down and place your legs up so your heels are higher than the level of your heart. Stay there for 20 minutes. Gravity now works for you, pushing fluid from your leg tissues back into the bloodstream. Your kidneys will shift into active filtration while you are still awake. Within 40 minutes, you will feel the need to urinate. You will release the exact volume that would have otherwise woken you up at 3 in the morning. You are wringing out your legs deliberately so your kidneys can rest while you sleep. Finally, when you are in bed with the lights out, perform 30 repetitions of correct pelvic floor squeezes. Do not clench your buttocks or your stomach. Imagine pulling the muscles between your legs upward like an elevator rising to the 5th floor. This sends a signal to your brain that the valve is toned and the system can rest. This protocol works because it is built on physics and biochemistry, not wishful thinking. I want to hear from you in the comments. How many times are you waking up and how old are you? This information helps me shape future videos for you. The healthcare system profits from managing your symptoms indefinitely, but I profit from you not needing me anymore. Subscribe to Dr. Ben and hit that like button to help us reach 1,000 subscribers. Every person who joins us makes it more likely that the next person who needs this truth actually finds it. Tonight, wring out your legs, quiet your mind, and finally get the deep sleep you deserve.